I can do that. That's great. Ready to go. Good. Now I'll use it. If you're going to see time, I'm going to take a lot of time. Texas. When we actually started today,
Go ahead.
Good afternoon, everyone. We're going to go ahead and get started. So I am Cecilia Rouse, the president of the Brookings Institution, and I want to thank you all for being here today for the launch of the Brookings-AEI Commission on U.S. Rural Prosperity, or America's Rural Future. This initiative will be dedicated to advancing policy ideas that support a healthy and thriving future for rural communities across the country. Brookings and AEI first joined forces over 40 years ago. In January of 1983, we co-hosted a 4-day briefing for new members of the 98th Congress, 26 Republicans and 58 Democrats, that focused on economic, defense, and social welfare issues. From the very beginning, our partnership has been rooted in a shared commitment to cross-partisanship and ideological independence. That commitment continues today, although in more daunting circumstances. The 98th Congress, convened in 1983, is remembered as one of the most bipartisan in American history. It enacted around 670 laws, many of which address contentious issues, from Social Security amendments to a major revision of the Federal Criminal Code. The 118th Congress, which concluded this January, leaves a markedly different legacy. It enacted approximately 270 bills, about 400 fewer than the 98th Congress and the lowest total since the 1940s. Moreover, some of the bills enacted were strikingly non-controversial, like amending the U.S. Code to designate the bald eagle as the national bird, or requiring the Treasury to mint coins in commemoration of working dogs. In short, we are living through a high point for patriotic animals and a low point for bipartisan governance. That's why today's launch of the Brookings-AEI Bipartisan Commission is so critical. This commission will be co-chaired by former Senator Heitkamp of North Dakota and former Governor Chris Sununu of New Hampshire. Its activities and research will be facilitated by Brent Orrell of the Senior Fellow at AEI and Tony Pipa, a senior fellow here at Brookings. Together, this group will elevate the national policy discourse on rural development, offer practical cross-partisan solutions grounded in local realities. Far too often, rural America gets overlooked by our nation's media and cultural power brokers. And when it is noticed, it is frequently pigeonholed. The dominant narrative casts these communities as places in decline, their residents as backward or bigoted. Even well-intended portrayals can be patronizing, describing rural Americans as ordinary or everyday people, as if those of us in urban areas are somehow more exceptional or important. This view is both inaccurate and incomplete. Just like the rest of our country, rural America encompasses cultural, demographic, and economic diversity. On the economic front, there is no doubt that some rural communities are struggling. But some of the most advantaged places in the U.S. are rural. Homeownership rates are higher than in urban areas. And today, exciting economic opportunities are emerging from new manufacturing and clean energy to the expansion of AEI data centers, which will be largely built in rural places. The problem is this. Washington often makes policy about rural America without first taking the time to include rural voices. At Brookings, we pride ourselves on being an evidence-based institution, but evidence doesn't come from data alone. It comes from listening to people. To understand rural America, we have stayed connected to we have to stay connected to what's happening on the ground. Only then can we tackle the challenges people face and help maximize the opportunities available to them. And that's exactly what this commission has set out to do. Before I hand things over to Robert Doar, president of the American Enterprise Institute, I want to thank this commission's supporters, the Robert Wood Johnson Foundation, Ascendium Education Group, CoBank, and the SCAN Foundation. I also want to reaffirm Brookings' ongoing commitment to independence and impact. And with that, Robert, the floor is yours.
So I am very pleased to join CC in saying how happy all of us at AEI are that we're partnering with Brookings on this important initiative. Senator Heitkamp and Governor Sununu, along with Brendan Toney, will do an outstanding job examining the real condition of Americans who live in our rural communities. Now at AEI, we like to say that we may be Washington-based, but we are not Washington-focused. And this initiative announced today is another in a series of initiatives that have brought our scholars and our scholarship to communities around the country. In just the past year, we have conducted working groups and gatherings in Tulsa, Oklahoma, Lexington, Kentucky, and Memphis, Tennessee. So I look forward to seeing the results of this important study, and I'm grateful to all of those who are participating in it and who have agreed to do this important work. So my job now is to turn it over to Tony and get us started. Thanks very much.
Well, thank you, Robert, and thanks, CC, both for your collaborative leadership and for bringing our institutions together to take the future of rural America seriously. And I'm also deeply grateful to our co-chairs and also the commission members who have committed to join us on this journey. We'll publish and share a full list of the commission members and a calendar of events a little later this summer on our website. But for now, just a big thank you and a lot of excitement at the beginning. So I'm Tony Pipa. I'm a senior fellow here at Brookings, where I do research and analysis on the effectiveness of federal rural policy. I'm originally a small town boy from Pennsylvania. And some of you know me from my podcast, shameless promotion, Reimagine Rural. Find it wherever you listen. Third season's about to start, where we collect the stories of rural places that are experiencing positive change. Before we hear from Senator Heitkamp and Governor Sununu on their vision for the commission, Brent and I thought it would be good to provide some context. And so I'm going to provide a very quick overview of rural America and start off by saying even that phrase, rural America, belies just how diverse our rural communities are, as CC alluded to. Geographically, economically, racially, culturally. So whatever picture pops into your head whenever I say rural America, it represents just one small sliver of the country's rural landscape. Maybe you think agriculture, yet ag generates just 7% of rural employment. You might see a white person in your head, yet almost a quarter of the rural population are people of color. And the fastest growing population is Latino. The geography extends from the rugged landscape of the Badlands in North Dakota, where Senator Heitkamp hails from, to the picket fences of Senator Heitkamp, the picket fences of Governor Sununu's New Hampshire, and to the hollers of West Virginia, where Chris Stirewalt grew up. And that's, I think, the first major point, is just the breadth and diversity across rural America is exceptional. But defining rural is not straightforward. The federal government has more than a dozen definitions. So this is the definition of the Office of Management and Budget: metropolitan, non-metropolitan areas at the county level. Rural is the brown, and it gives us a population in the country of 14% of rural. Now let me go to this definition by the Census Bureau. Factors in housing and population density, adds a larger geographic footprint, still brown, makes more people in the surrounding metro areas rural, and results in a rural population of 20%. It's a difference of almost 20 million people and less than 45% overlap between the two definitions. For our purposes, we often use the first definition or others like it, where rural places are more self-contained. And that's because we find that rural is as much about community identity, kinship, and state of mind as it is about population or geographic classifications. And I think that's the second major point. Despite its diversity, rural places often share a set of unique characteristics that go beyond size. For example, when a rural place experiences change, whether it's positive or negative, it's often felt more directly and acutely by its residents, by the people who are living there. And I interviewed for the podcast a young rural tech entrepreneur, Chris Carnell, and he said to me, you know, just as a startup is not a small version of a large corporation, a rural community is not a small version of a city. And that's a really important for policymakers and a really important point for us to keep in mind. So rural places are central to the country's overall future. They provide our food, energy, water, fiber. Manufacturing jobs are proportionally higher in rural areas, and rural is often where the country goes to recreate. But how are rural places doing? So this is a map of advantage and disadvantage that's developed by the authors of the Justice of Place that Brent and I interviewed on our On the Front Porch series. The lightest is the most advantaged. The darkest blue is the most disadvantaged. Now watch as I switch to rural communities. Notice how the light blue remains. As Cece said, some of the most advantaged places in the country are rural. High levels of social capital, proportionately lower levels of inequality, most of the people in those communities solidly middle class. These communities have a lot to teach us about economic stability, but most of the dark blue remains as well. Rural communities make up some of the most disadvantaged places in the country, places that are challenged by changes in the national or global economy. Often the legacy of an extractive economy based on natural resources, or due to economies that relied on a major employer or a single industry that was lost. I personally grew up in the anthracite coal country in Pennsylvania. The rural town where I went to elementary school is now dealing with persistent poverty. Anthracite coal left decades ago. And in fact, 85% of the persistent poverty counties in the country are rural, and almost half of their aggregate population are people of color. The dual burden of race and place is really rural in America. Now, rural places are seeing potential new economic opportunities. AI revolutions bringing data centers to rural places. Rural will be where we continue to get our energy, whether it's old or new energy. 99% of the wind turbines are in rural America, and there's so much new manufacturing in rural Georgia, we're calling it the battery belt. But as rural communities seek out these new opportunities, I think it's really important to ensure that we're just not recreating the extractive economies of the past. And we have to recognize that policy changes could have significant implications for rural places, and a single policy change can have a lot of ripple effects throughout a rural community. There are changes to healthcare and nutrition programs that were being contemplated and maybe are passed today, I'm not quite sure, that shift more responsibility to the states. And for example, Medicare disproportionately covers rural people, but whatever the impact of that change, it's going to extend beyond just the health outcomes for those people. The health industry is a major employer in rural economies, and rural hospitals often play a key role in local economic development. I think it's an example of how one single policy can impact many different aspects of a rural community and demonstrates how the work of the Commission, which will focus on creating the brightest future possible for rural communities, is urgently needed. So just let me end. A few years ago, we landscaped the public federal investment available to rural areas for their community and economic development. On the left are the federal offices and departments where those investments are available. In the middle are the issues they support. On the right are the congressional actions that authorize them. Many of them go back decades or more. You can see how challenging a maze it is to navigate, especially for rural places where one person often does many different things. And on one hand, this is the project of a very responsive government. Congressional members created these different programs because the constituents asked and declared a need. But I think it signals a lack of a coherent vision for how rural places will thrive in the 21st century. And creating that vision, one that's especially informed by local rural people and leaders, is really a primary goal for this commission because the future of rural America is central to the future of our country overall. And thanks for your interest in our rural places. And now I'm pleased to turn it over to someone who has become a trusted colleague, a true partner, and a great friend, and who I'm indebted to for coming on this endeavor with me, Brent Orrell from AEI.
Thank you, Tony. That's really a remarkable chart and something that is going to be top of mind as we pursue the research agenda for the Commission. And that's what I'm here to talk with you about. And Tony, as we were just discussing over lunch, dragged me into this project. And I'm so glad he did because it's been fascinating. We haven't really even gotten started yet. So very excited about it. I'd like to thank CC and Robert for their support for this project, and to our distinguished co-chairs, Senator Heitkamp, Governor Sununu, for their leadership. This is an amazing team effort coming together here. My task here today is to give you an overview of the key areas of research the Commission will undertake over the next 2 years to fulfill its goal of creating a federal policy roadmap for rural America, one that is rooted in what we learn from rural communities and the challenges and opportunities they face. We have 5 basic pillars. You can put that slide up. There we go. Okay, so we have 5 pillars to our research program: workforce and economic transformation, demographics and infrastructure and quality of life, health, finance, systems, and outcomes. I want to underline outcomes because I think it is so critical to the future of rural prosperity. Climate, resources and resilience, and governance, policy, and investment. And that goes back to Tony's slide, and the incredibly complex system of programs, and not even a system, collection of programs that we have that endeavor to serve rural America. So let's start with talking about the first pillar, workforce and economic transformation. Rural communities are being reshaped by automation, by advanced manufacturing, and most recently by the emergence of artificial intelligence. For decades, automation has exacted a great toll on rural places. We know that the manufacturing base of the United States has always been predominantly in rural areas. We don't think of that. We think of the smokestacks in the cities. But the real heart of America's manufacturing is in rural America. AI is now automating white-collar office work, while trades like agriculture, construction, manufacturing remain relatively insulated, at least in the near term. Meanwhile, we have new AI-driven sectors that, as Tony mentioned, the data centers that are looking to rural places for expansion and sometimes finding welcome and sometimes not. So we want to understand that better. So we're asking, are rural workers and systems ready for this shift, ready for this transformation that's going on? I think the answer is probably going to be in some places, yes, they are. In other places, they risk falling behind. What kinds of skills and infrastructure do they need? How can federal workforce development policy help rural communities benefit from the new wave of investment? The battery belt, the data centers, the semiconductor plants. The second pillar that we're working on is going to be demographics, infrastructure, and quality of life. And that's really looking at population decline, demographic change. Rural communities are becoming diverse, as Tony mentioned, but these places still face real challenges in terms of shrinking tax bases, aging infrastructure, and limited housing. Pillar 3 is health finance systems and outcomes. Health outcomes in rural communities continue to lag metropolitan America, from obesity to diabetes to mental health and mortality. Rural hospitals are struggling, and the pending changes in Medicaid are likely to heighten those challenges. Pillar 4, climate, resources, and resilience. Rural communities are on the front lines of some of the most tragic and devastating natural disasters that we've seen in recent years. Floods, droughts, wildfires, but they are also home to most of both our traditional energy sources and our renewable sources. This concentration of energy production creates new opportunities for jobs and growth, and we're looking forward to examining that. Finally, on Pillar 5, governance, policy, and investment. Tony's chart says it all. We've got 500 federal programs across 13 agencies, which is bewildering. Even if you have a large government, state or local government interacting with them, but doubly so in rural areas. So, rural America is not a monolith. We want to pursue this grounded in data and listening to the voices of rural Americans so that we can better structure the federal-rural relationship and give more of these communities a chance to access the prosperity the American economy and our society afford. So we look forward to your engagement as we carry this work forward. Thanks. And I'm turning this over to Chris. Yeah.
You can come up whenever you want. That's what I think. I don't think they can stop us now. Senator, you're right there in the middle.
I got her.
You're as far away as possible. There you go. We're putting you down at the end. Trouble. We're putting you down at the end. And the green light is on, so that means that I can be heard. My name is Chris Steyerwalt, and I am but a simple country pundit. A son of Ohio County, West Virginia, grew up there, and I'm a senior fellow at the American Enterprise Institute. I'm very excited to be here today, and I'm very excited to be working on this commission. I'm very excited about all of it because I spent most of my young adult life trying to not be where I was from. And then I got to where I was going and I said, I wish I was there. And I think we need to create space for people to succeed and thrive in places that are too often forgotten. Okay. You should know that you already know that Heidi Heitkamp served in the United States Senate from 2013 to 2019. She was the first female senator elected from North Dakota. But before that, she was the state's tax commissioner. She was the attorney general. And she's the last Democrat to hold or win statewide or congressional office in North Dakota. Last one out, turn out the lights. She's also, I will just say, as a person who developed a reputation in Washington for being true to her word, for being willing to work with people on issues when she disagreed with them on other issues. And she was something of a, I would say, a lodestar for her conference. As they were trying to figure out how to navigate difficult times, they looked to her, and with good reason. She grew up Mantander?
Manador.
Manador. She grew up in Manador, North Dakota, is one of 7 children. And I just learned today that she was, it was a town of 90. So when you're gone, it's 89. And then when you go back.
My family was 1/10 the population.
Exactly. Now, that may also be true of the Sununus in New Hampshire. I'm not sure. There's a lot of them. Chris Sununu.
But only one matters.
This is how they're competitive. Chris Sununu was the 82nd governor of New Hampshire, 2017 to 2025. Before that, he had a real job. He had an engineering business that was actually successful. He did not go to politics out of last resort. He cleaned up hazardous waste sites around New Hampshire and was leading a perfectly normal, happy life until the family business. He got, like Michael Corleone, got dragged into the family business at the end. And I will just say, having covered him and known him for some time, I don't know whether you know this, the political road goes through New Hampshire pretty often. This is a good man, right? This is a person who has the courage of his convictions, and that means doing things that are unpopular sometimes, like saying no to people in his party when they don't want him to say no. That means working with Democrats. He has the scars to prove that he means what he says, and we are very lucky that they're here together and that they're doing this. So if we could get another gratuitous round of applause for these people. It's sadly rare. It's sadly rare in Washington. But you know what? This is a great day to not be in the United States Senate. This is a wonderful day. He didn't run. Today, I'm sure as he was walking down here, he thought, I'm so glad I did not run to be in the United States Senate. This looks tough. And this is a great day to be here and not there. But Senator, I want to start with you. In the end, what were they fighting about in the Senate as they were doing this? They were fighting about rural issues at the end because they got left for last, right? At the end, the rural states came forward and said, well, you can't cut our hospitals like that. And what do you do? What do we do about having a discussion that includes rural from the outset, and it isn't just the last thing on the table?
Chris, can I just have a point of personal privilege? The other members of the commission who are in the audience, could you just stand up? Because we've got great attendance here from some of our colleagues who are going to be participating with us, a wealth of information. What we have to do is quit governing in crisis and start governing from evidence, evidence-based perspective, and start being realistic about what those choices are. Number one, we are not going to live in a world where resources are infinite. We're going to live in a world of finite resources. And so that's what you're seeing debated right now. And every time they make a change, do they change it so that it costs less? No, it's just building more and more to build those coalitions. And so that's why I think the work of this commission is so important, because if you have that go-to source that says that program is not as effective as this program, what people are saying is they need, this transportation assistance for their employees. They need broadband to make sure that they can get telehealth. They, all of the things that we know could work in delivering services. I always tell people, what a cab driver in North Dakota wants or in New York wants is really not different from what that small business owner in Carrington, North Dakota wants. They want security for their family. They want to be able to retire with dignity. They want their kids to go to great schools. They want health care for their grandmother. The desires are the same. What's different is how do you deliver the product? And that's why we want to differentiate here in what we're talking about in terms of rural progress and rural deployment of resources. And so to me, what you're seeing right now play out is we don't have a farm bill. We're not likely to have a farm bill going forward. We already have frayed that relationship, the urban-rural relationship, in this big, beautiful bill, and it's going to create even more stress on a unified, everybody wins when we have good rural policy kind of legislation. And so what needs to change is we need to basically do the work of building coalitions around ideas and leadership, and having leadership that's willing to advance it and hold firm. And when you legislate through crisis, you get chaos and you get bad decision making. And that is what I think we're seeing right now on Capitol Hill.
Governor, before I ask you, if I don't say this, I'll get in trouble. I'll get kicked off right away. I'll lose my post on the first day if I do not say the magic words. Online questions. Yes, we see you, Internet. We know that you're out there. Online questions can be submitted to events@brookings.edu or by using the hashtag Rural Commission on the artist formerly known as Twitter. Okay, Governor, I remember the first time I went up in the White Mountains, and I had always thought of New Hampshire as rich people on the seacoast and then tax refugees down in Manchester, and I didn't think about it. And then, as a West Virginian, I got up there and I said, this state is full of hillbillies. And I was into it. I liked it a lot. Talk about...
Thank you.
Yes. Are you kidding me? Heck yeah. Talk a little bit about the misunderstanding of what's rural and what's not rural in the United States.
Sure. So, New Hampshire's a fairly unique because it's all of New England is fairly unique, right? Because in New England, each state relies on each other in certain ways. In southern New Hampshire, to your point, we're 30 miles north of Boston, which is like one of the healthcare epicenters of the planet, right? Amazing opportunity. You go 30 miles north of that, and you get north of Concord, whole different world. So we had to deal with, we were constantly kind of crossing these issues. When we did a piece of legislation in New Hampshire, it was always, well, what's going to happen in the North Country? How does this affect folks in the Monadnock region? And yes, there's always a sense of the haves and the have-nots, if you will, with the seacoast and the southern tier and the northern tier. So I think as a governor, and I think this goes for most governors, maybe New Hampshire's a little more unique, but every governor has cities and every governor has rural areas. Every governor, every legislature has to deal with these things on a consistent basis. And, one thing we were talking about earlier is my thesis is the further you get away from the people, right, local government really deals with things in a nonpartisan way because it's just about who's going to collect the garbage and the recycling, and are we going to build a road here, and what happens to our wastewater treatment plant? And then at the state level, it's a little further away, but again, still fairly connected with your legislatures. When you get to the federal government, they almost have the lack of discipline and the luxury, if you will, to just live up here in the headlines. When we talk about what's happening with the big, beautiful bill, it's Medicaid cuts are here, and these people aren't going to get services. Well, it's so much deeper than that, right? You have to go out into the heartland, if you will, and say, okay, if let's say a hospital doesn't get their money in Chicago, that could be a real problem, but Chicago has 7 more hospitals. If a healthcare center in rural Iowa doesn't get, it's done. There's no more services. The fragility of the systems because of a lack of redundancy and the needs for other things like transportation, and then you're going to hear about transportation a lot. Because again, no matter how great your service, you could have the best healthcare system in the world in rural Missouri, but if there's no bus to get you there, if there's no transportation system or whatever it is, that becomes a real problem. So there's the needs are, as Heidi pointed out, the needs are the same. The dynamics of how you go about it different. And I think the opportunity here is really getting to that kind of localized and state level discussion, and then bringing, Heidi talks about this a lot, bringing those best practices, sharing those best practices. Like, why did West Texas fail in a certain area, but Eastern Montana succeeded, right? Let's share that. Right, and the actual practice, that actual doorway of opportunity for that service and for that system, and then bring that up to the federal government as well to make sure those policies are either mimicking or at least not prohibiting that type of access. And I would just, again, say as governor, so often it's not even Congress, it's just the bureaucracies within the agencies, the rulemaking, if you will, is so limiting to governors often, or mayors, or localities, because everything in Washington's one size fits all. This rule now pertains to everyone in America. But believe me, what California's rural area needs might be very different than New Hampshire or Mississippi. So it's that bureaucracy that we're constantly fighting because it sounded good up here, but they really didn't take the time at the localized level to say, oh, wait a minute, it works or doesn't work, or have the discipline to say, maybe we shouldn't be creating these rules. Not all of them, but some rules are created in Washington, as we all know, thousands of them, that should have never been created in the first place. Let the states figure it out. Let the localities figure out, because that way, as the resources get diminished, and guys, they are getting diminished.
All right, I'm going to have to invoke cloture.
Yeah.
I have to invoke cloture,
Sorry,
not only to say this, because I'm going to ask Governor Sununu in a minute to talk about the same subject, but I want to point to a success he had in his state, Senator, which was, and I want to say this to get it out of the way because I hate it so much, which is we can't talk about what's going on in rural America without talking about addiction, and we can't. It is tragically, as I say this as an Appalachian, there's just no way to have the conversation without talking about it. And I'm going to ask the governor to talk about their program in New Hampshire, which was a real success. But you were statewide in North Dakota, and then you were in the Senate in North Dakota when the wave came through, right? Like when we went from meth to opioids, and it laid waste to a lot of these rural places. For a generation, we had talked about drugs in America as an urban problem, and then all of a sudden we woke up one day, and it was rural communities, and it was taking its toll. This affects workforce. This affects family formation. It affects everything else. When you think about that issue, when you think about North Dakota, the rest of the country, what are the things that you found that worked, and what are the things that you found didn't work?
Well, first off, just to kind of calibrate, I was one of the negotiators on the National Tobacco Settlement Agreement, which was, I think, one of the most successful, the anti-tobacco campaign that really started probably back in the 70s, that made its way through to the settlement of the agreement. Was really remarkable because it was a collaboration between public health professionals, legal professionals who looked at various levers, legislators, and governors and attorneys general. I mean, you think about all the people that you brought into the room, along with cancer. We used to call them the body part groups: lung cancer, heart. And bringing everybody together to actually have a conversation about how do you tackle this problem. And, you know, I think and trust me, as North Dakota's Attorney General, I ran our drug enforcement program. And everybody talks about opioids, but the methamphetamine epidemic really led the challenge for so many communities, especially Native communities, where meth still is the drug of choice in Native communities. And so if you look at this, I think it was all approached from, this is a law enforcement problem. And my line always was, you will not supply side your way out of this problem. You will not win if all you're doing is trying to control the supply. You have got to basically provide a multi-layered approach. And you've got to train professionals. And I think we're retreating from some of that we're doing. That seeing remarkable results doesn't mean that we're lowering addiction, but what it does mean is that we are stopping the morbidity, the deaths because of addiction. Now you might see that turn up because we're now not funding harm reduction programs, because if you fund those, it seems like you're agreeing that the use is okay. If you're funding, drug courts, you're not taking the punitive approach to drug use. And I think that a lot of this activity was born out of state. The drug courts was a state idea that the federal government eventually operated. And so a lot of what we were able to do was lead with good innovation in state organizations and state legislation and local work. And we've got to get back to that if we're going to be successful. But I want to leave you with two stories. Number one, I think at the time when I was serving in the United States Senate, about 60 to 70% of all addiction treatment was paid for by Medicaid. You think about somebody who's heavily addicted, can they work? Or, more importantly, do you want to hire them, right? And so this was a program that brought services and brought health care to the addicted. And so that's a challenge right now. The other thing I want to tell you is that the safety net that has always been the family structure is stressed to the max in addicted families. And so I remember sitting down, we have a program called PATH, which is the foster care program, where we were looking at adult foster care, grandparents fostering, kinship care, and how we could maybe change the system so you didn't have to give up custody of your kids in order to get the kind of help that you needed to get. And I was sitting with a woman with a family, very successful, middle class, upper middle class Fargo family. And it was, I think, parents in their mid 60s. And their daughter had been addicted and was in prison. And they were taking care of their kids. And she said something that I'll never forget. She said, we were thinking that at this point in time, we would be looking at buying a vacation home in Phoenix, in the Phoenix area. Now we're looking at, can we afford a minivan? And so as we look at and that's what getting out there and actually visiting with people, finding out what their challenges is so critical, because you don't think about what is the need of that grandparent who now has taken on the responsibility, and then, only to have their kid come out of prison, basically try and secure custody again, only to have a relapse, and now the children have been ping-ponging back and forth. And so these are challenges that in so many ways affect the rural workforce. They affect a attitude that is pervasive of things are not good in my life and I need some additional help. And I think just a little bit of help to families who are doing that kind of work is absolutely critical. But I think when this is my soapbox, but if we don't think about punitive behavior as it relates to the addicted or the incarcerated, and we think about what do these kids need and how do we deliver what they need and help whoever is going to help them a little bit more.
I know a guy who told Law and Order Republicans in his state that they were going to have to accept those very kinds of things. Talk about that, Governor, but also talk about the economic, part of the argument that you made in New Hampshire was the knock-on economic effects for the workforce and for everybody else to create a sort of, this is a phrase I hate, a whole of government approach, but that's what happened.
Yeah, so I mean, just to take a step back, one of the first, as a lot of folks know, we had the second highest death rate for opioids when I became governor in early 2017. And I mean, I won't go into the whole story. I'll write a book on it someday. But what I quickly realized was the addiction rate in rural parts of the North Country of New Hampshire was 4 to 5 times that than our inner cities. And everyone's like, oh, but the inner cities is where the drugs are. No, the inner cities were where the treatment centers were. And when I would talk to people in the North Country, well, I said, why is this? And it was like, well, what do you expect us to do, Gov? We're going to drive 150 miles to Manchester, probably lose my job, lose my kids, maybe get better, maybe not. Nah, it's opioid. I'll just tough it out. That was the thing we heard. Oh, well, tough it out. And I'm like, oh my God, that this is where the system's broken. And so I don't mind saying I went home. This was a little after the 4th of July in 2017, and I was up on a Saturday night, and I was putting pins in Google Maps. And my theory was, how far would I be willing to drive my car to go to a recovery program? Well, maybe 30 or 40 miles at most. Beyond that, I'm probably not going to go, right? So I started putting pins in maps, and I got it down to 9 pins where you could get to pretty much anywhere in New Hampshire was only about a 40-minute drive. And then I was able to line those up with hospitals, actually. And I connected, and I said, we're going to have a hub and spoke model. And to his, I'm not here to tout the Trump thing, but I came down, I spoke to the president directly about it. President Trump understands that issue big time because of, losing his brother. And Jared and Ivanka really got it. And next thing you know, I said, I need money to create an infrastructure, a whole new infrastructure. They created the SOR grants, which states got. Long story short, we created more of a hub and spoke system. And I would go to the nonprofits and I'd say, look, if you want, your nonprofits are the ones that run these recovery centers. They run the treatment programs. I said, if you want the money, fine, but you have to make a certain commitment to rural areas. And you got to set up these shops We're going to connect them to hospitals. You know, we had people doing overdosing. Look, if you overdose and you get Narcan, maybe at the time you get taken to the hospital or not, you dry out for a couple hours at like 2 or 3 a.m., you're just walking out the door, literally. And the hospitals were like, well, good luck. Should go probably go to a recovery center. But the hospitals weren't directing the patients anywhere. There was no interconnection. They lived in a silo. And I got really upset with the hospitals, actually. To this day, I'm still in a fight with them on it. And so I said, I'm going to force you, if you want the state money, if you want all these other opportunities, you have to, these 9 facilities especially, have to set up kind of sister locations to be. So when that person dries out in an emergency room, they're walking right next door, like literally being handheld next door into the recovery center when they're at their most vulnerable. I bring that story up because it was a rural issue that we created a huge statewide solution for. It made the dollars more efficient. It incentivized workforce in certain areas. It got the nonprofits thinking bigger, not just in their mode of, well, look, just give us the money, we know what we're doing. No, they were running a system like it was 1992, right? Like it was still a crack addiction or something like that, and spice and marijuana. Heidi brings it up exactly. It all started with, to use Chris's word, the hillbilly heroin, right? And you're still seeing that, especially on reservations in the Native American culture here in America, and they go. I think that's a huge discussion that I think this group has to dive into. And the last thing I'll put, this is just one example, one issue of opioids, right? But believe me, it's a Venn diagram. It's all interconnected to mental health. It's all interconnected to healthcare. The fact that someone stays on opioids, guess what? Their heart, their liver, their pancreas, it all deteriorates. They have to get, the cost of healthcare skyrockets in those areas because you have to do more transplants. So Medicaid costs more, Medicare costs more, the treatments cost more because the acute health issues start deteriorating. People drain their 401ks, to Heidi's point, they drain their 401ks to make sure their kid is in a recovery program, praying they don't have the recidivism. What's happening behind the wall in prisons? Do we have Narcan there? All of these pieces. The last big one was workforce, right? So I created something, when I ran my ski resort, I had people that were addicted. And for a while we would, he's addicted. Yeah, we got to get rid of him. He's stealing from us. We got to fire him. And I realized that's the worst thing because it's hard to find a good employee. I was sending them back to the wolves. They had no job. It was almost a predetermined death sentence, I felt like sometimes. So I said, look, guys, I'm not going to fire you because you're addicted. Come talk to me. I'll get you into a program. We'll keep you employed. The self-worth value of staying employed, of having a normal life while you're going through recovery was so valuable. We created something called recovery-friendly workforce and workplaces, where I would train the workforce, manufacturers, Dunkin' Donuts, McDonald's, anyone who would do it. I would certify them as recovery-friendly, and that meant that if you work there, go talk to your employer about it. They want to keep you as an employee. They'll help you get into a program and shepherd you along. And guess what we found? Immediately, the number of people in recovery programs skyrocketed. And I went, oh, no, the problem's so much worse. But we finally realized, oh, no, people were going to get recovery because they weren't afraid of being fired anymore. Oh, holy cow, they could talk to their employer. And so now there wasn't the shame, the stigma, the fear. And guess what? They would have mental health services that would be attached to that. So it was a positive cycle. I mean, it's not perfect, but believe me, there's still obviously lots of problems in our system across the country. But it was a great example of the domino effect of when you really get to the grassroots of one thing, which is what this organization is going to be doing, it has a domino positive effect for all the other opportunities, specifically where there's no resilience and no backstop.
What was the mortality decline in New Hampshire from 2017 to when you left office?
Greater than 50%. We cut it more than in half. It was more than pretty much. I think we went from the second worst in the country to about the 17th best or something like that. I mean, look, one is too many, right? But it was huge.
As we would say in Southern West Virginia, this is actually true. This is actually true. Okay, we're going to get to good news things. I promise we're going to get to good news things. We're not going to dwell on the things that are wrong. But I was struck looking at that map, Senator, when you look across the country and every data table that I've ever looked at this stuff, when you look at the tribal lands, right, the deepest pockets of poverty, and, you know, Appalachia has its swath, but the deepest pockets of poverty in the country on these tribal lands, this is something that you very much had to deal with in the Dakotas. When we think about that, it's tempting to think about it as a set aside. What works in answer to that problem, and what doesn't work in answer to that problem?
I think for so many years, the idea of how do you bring opportunity to Indian country was, let's put a defense contractor there and they're all going to work in the factory. Yeah, I mean, no choice. This is your one opportunity. And culturally, the significance of family and taking care of each other is just embedded. And so to think, oh, they should move here or move there and lose all of their connectivity spiritually and culturally is just a non-starter. But what I will tell you about Indian country is it's full of very entrepreneurial people. It's full of people who want an opportunity to grow a business, to take a good idea, expand that idea. Guess what you need to do that if you're going to be thinking about a reach beyond just marketing whatever you're going to do to your community? You need the internet. And North Dakota is a great example of this. Because of Byron Dorgan, who was worried about the digital divide years ago, we're one of the most rural connected states in the country. In fact, my mother-in-law, who lived on a family farm outside of Jamestown, 20 miles outside of Jamestown, she had better internet than they do in Fargo because of the commitment that the rural telecoms made and because of the resources Byron was able to get to North Dakota. And so it wasn't, but guess where they don't have services? They don't have services on the reservation because nobody was basically making that a priority for the last mile. The last mile was in Bowman, not in Standing Rock. And so if you look at, and this is why it's so important to get out and actually have a conversation, because when you go out and have a conversation, you say, well, I'm sure you want to, rivet, or make Kevlar vests. Well, I want a paycheck, I want a living, but I don't like that work. And so guess what happens? People start dropping off or they don't end up going to work. And so it's just a cycle. And then it's criticism of you had a job and you left. Well, guess what? I had a job I hated. And you aren't speaking to what I want and what I need. And that's why I think if we approach rural communities, especially Native communities, with the attitude of how can we help you be enterprising? What do you need to basically expand your good idea? Whether it is, building something. There's a number of really fascinating projects out there of building tribal corporations, which are very diverse in terms of what they offer. And, to me, the real problem that we have for economic opportunity in Indian country is we have been doing it to them, not with them. And if we turn that around and say, what are the needs and how can we better deliver the infrastructure that, guess what? Other parts of rural America have, but you don't, whether it's safe drinking water, whether it's broadband, whether it's wireless, what are those things that we need to be doing and how do we do the next connect? And so a great example is my husband's a family physician, works in Mandan, which is just, 60 miles north of Standing Rock. And he had patients who would come to him because the money at Indian Health ran out, which is a whole other issue. Literally, his patient, bad diabetic, was 80 miles away from any kind of health care. Now, wouldn't it have been great if he could have done a check-in every day with telecommunications or with telehealth services so he could better practice medicine, but also help save lives. And so we just need to be very strategic about how we approach Indian country. But I'll tell you, we can't approach them as missionaries.
Can I say something only because just to harp on what Heidi said, you hit a really great point there. With technology and all this comes an amazing opportunity for home health care, right, when we're talking about that, dialysis in particular. I mean, I don't know, I'm probably going to ruffle some feathers here. There's basically two companies that run dialysis in this country. I think it's
paid for by the federal government.
That's right. And I think it's pretty much a scam. But there's new technologies coming on. No, I do. But there's new technologies. And I'm just using this as one example. So as technologies evolve, are there barriers that are preventing that from being reimbursable through Medicare or Medicaid? Are there barriers and rules that prevent certain opportunities to come to the market, that home market, faster? right? Sometimes because it's in the home, it's not regulated as much. The government gets a little more nervous. They want to pile on a little more but how do we enhance the technologies as workforce shrinks, as resources shrink, and as rural issues I don't want to say get exacerbated, but I think the technology opportunities on healthcare are just huge.
Okay, well, that leads me to the question I actually wanted to ask you, which is, New England was America's first Rust Belt, right? Merrimack River. We go back and
You can still smell the shoes.
The story of American industry has been moved to a more remote place and do something that was either extractive or environmentally damaging and move on down the road, right? And where I grew up, that happened in the 1930s and 1940s, but it's been the story across the country. I also know that politicians my whole life have told me that they were going to bring those jobs back. It was going to come back. And they were all lying, and they will always continue to be lying because it's not going to be 1945 in Wheeling, West Virginia ever again. We do, however, have 400,000 unfilled manufacturing jobs in the United States today, but they don't look like what they looked like in those days. Big vertically integrated mills and all of that stuff. It's a lot more decentralized. It's a lot harder to see, fund, and do all that stuff. But the job openings are there. What can this commission do? What did you do? What is your insight on trying to connect people who need those jobs and want those jobs with those employers who want to hire them?
So I think there's two issues there. First, I think you're going to your point, you're going to have a more decentralized manufacturing coming into America. I do think those jobs coming back, no, but manufacturing is definitely here, and there's a need. You're going to have more and more of these manufacturers going to robotics, and that's what you're going to see in a lot of rural America, right? You're going to have, instead of a manufacturing plant that makes car doors with 300 people, they're going to have 50 people and a whole bunch of robots in rural America. But then there are certain jobs that you just need bodies for, right? AI will replace a lot of things, but it won't replace carpentry, and it won't unclog my toilet, and we're going to need plumbers, we're going to need welders, we're going to need all of it. So there are certain, that's where I think there's going to be a huge workforce need. And again, not to get overly political, but it's one of the reasons why no matter what media outlet I'm talking to on any given day, I always try to crowbar in, you need immigration reform. Right? I mean, that's a big issue in rural America, believe it or not. A lot of people think that all the immigrants and all the people that come in, they're all just going to the inner cities. They are not. That is old school thinking. Depending on where they're coming from and what their background is, they're going to go where the jobs are and where the opportunity is. So it's a housing issue. It's an immigration a reform bill that really has to come, because you need the bodies here. We're not going to grow the bodies we need, if you will, the workforce we need for the future. We'll need theoretically less workforce with more technology, but in America, I don't know, I mean, this whole Gen Z, they're having less kids later in life. It's a cultural thing here in America that's a real problem. So I don't know whether this group will get into that whole thing, but there's no doubt that there is a need to get the workforce in here. We are a melting pot. This is where where we need to be, and whether you're Republican or Democrat, it has to happen at some point where we're making sure that those ports of entry and that process is happening for the workforce in rural America. I just think that, and I'll pick on my own party, I think Republicans in particular think that immigrants just go to the cities and they're blue cities and they vote Democrat, and so, if we're not jumping on that issue right now, it's okay. It's not. It's going to really hold this country back.
If I can just add, because I think we're talking about workforce, but it's interconnected with all of the other kinds of issues that we're talking about. Are you living in a place, I used to say this, where you can get Netflix? I mean, now streaming is just the way of the land, right? And so what is the quality of life? What is the affordable housing in that place? What are the amenities in that place? What does the community look like? Is the community accepting? And so what I would say is, as you're talking about workforce, which is why this commission idea is so important, because you can draw a thread through all of these things. And what they will tell you is that you can't solve the workforce issue without solving the demographic and infrastructure issue, without solving the healthcare issue, without looking at good governance. And so when you draw, when you try and silo each one of these 5 areas, that's not our approach. Our approach is how do these all interact to create an ecosystem? And I know that is an overused word, but how do they interact to create an ecosystem that creates opportunity? Opportunity not just for, you know, that new manufacturing, but entrepreneurial opportunity.
I won't criticize you for saying ecosystem. I said whole of government approach earlier.
There you
We're
go.
all in a bad
Buzz,
place.
buzz,
Yeah,
buzz.
buzz, buzz. Okay, I'm going to put the same question to the governor, but I want to start with you because I think your story is more illustrative here. So our parties have big blind spots on a lot of issues. The part of the problem with our duopoly in politics is that it's too easy to be wrong for too long. You don't ever pay. You don't ever pay the price, because if only Coke and Pepsi are for sale, people are going to drink a lot of Coke and Pepsi. And at the beginning of this century, an argument ran through the Democratic Party, and it was centered around an idea. There was a book called "What's the Matter with Kansas" that Thomas Frank wrote, and the argument was basically that Republicans had tricked rural America into voting Republican using social and wedge issues to pry them away from the progressive economic policies that would have made it better, And of course, when Barack Obama won the 2008 election, many Democrats said, it's happening. We're moving away from that. We don't have to think about these flyover country. We don't have to, they're backward, and we don't need to worry about them. I watched you for 6 years in the United States Senate drag your party by the lower lip back to middle America, back to this stuff, and say you can't offend the sensibilities of the people whose votes you want. You can't talk down to them, you can't ignore them, and you can't do that. Democrats have woken up to their blind spots. They've woken up to what you were telling them, right? After the 2024 election, it's cool to be rural, it's cool to be small town. Again, what's the Democrats' blind spot on this, and how do they get better at it?
I think clearly the blind spot is, look what we've done. Look what we stand for. Pat ourselves on the back. Why do they vote against their interest? And I go, no one ever votes against their interest. Stop it. That is a nonsense thing to say. Why aren't you speaking to them about what the needs are and how you need to, not change your values, not change who you are, but how do you connect in a more significant way? One of the things that I would say is that the stories that go into the local watering hole, right, will be a story about, some inspector from the federal government came out and I had an open pesticide can and I got fined $10,000. That happens. And so isn't that ridiculous? Or, I was farming and I went too close to a prairie pothole and now I owe, conservation program $10,000. And everybody wants to focus on those wedge issues. And I'll remember, if you read What's the Matter with Kansas, there's a lot in there about abortion. Guess what Kansas did? Passed an abortion protection law that went very well, by the way, in rural America. So get off the cultural stuff and start looking at those things that speak to overreach of the federal government. I used to challenge my caucus. I said, why do you want to be the party of dumb regulation? No, seriously, why do you want to be the party of overreach and stupid regulation? And it happens, and you hear it every day. And it may be unique or discrete. They go, well, that doesn't happen. I want to say, yes, it does. Go out there and visit with people. And so I think where the Democrats went wrong is they think if you just have broadband, well, they should love you because you've delivered broadband, or you've delivered a conservation program, or you've delivered this, instead of saying what is the best way with the least amount of intrusion in your life to provide some opportunity. And so, I started a group called One Country Project, which is a political organization. And people say, what is this? I said, it's to reintroduce the Democratic Party to rural America. To reintroduce them, here, this is who we are. And I think that there is so much generalization about who rural people are. And we talked, and I think Tony did a great job talking about more diverse, sometimes aging, not as healthy, but, we're catching up. And so I just think that I have a friend, David Axelrod, who says it best, and I have to credit David.
Name dropper.
Yeah,
Your
name dropper.
I have a
Well,
friend,
we
Dave.
work together, so I get to drop his name. And he said, the Democratic Party approaches rural America as missionaries and not neighbors. And I think that sums up kind of that. And the more people think that you disrespect them or pity them or have to give them something or that you should be grateful for what they got, the more they're going to retreat. And so that dialogue we need to be honest about what the frustrations are in rural America.
So, Governor, the Republican version of this is...
We're just fine. We're good.
You're fine, no problems. The Republican version of this is there's a guy, he's got a sleeveless American flag T-shirt on. They're blasting the Lee Greenwood Republican national anthem. This is Heartland America, baby. This is right. This is
real America.
These are the real Americans. This is God's country out here. And we're not like those bad folks in the city. We're not like the bad people in the city. So the Republican brand now is deeply rooted in a fictional version of rural America that is supposed to be more virtuous, more wholesome, more American, more religious than these folks in the cities and in the suburbs, these decadent, these rootless cosmopolitan elites who are down in the cities. These are the real Americans out here. Yeah. I know for sure that prevents Republican lawmakers and people in government from seeing what's actually happening in real America because they're looking at an idealized, often very white version of what's actually going on instead of the real thing. Is that fair?
That's fair, but I mean, I don't want to be overly defensive, but I do think it's changing. I think the 24 election really showed that. And again, I'm not here to tout Trump or the Republican, but the fact is Trump got more of the African-American vote than, any other Republican president candidate in history. And I don't think he got more of the Latino vote. Maybe Bush did that or something.
He got more since the 1960s.
Since the 60s, right, right, exactly. Yeah, that's in modern times. So there's definitely some inroads there. Now, why that is, I think people are still trying to dissect that and figure that out. But there's no doubt minorities and people of color came out more for Trump in 24 than before. And if you saw, again, not just talk about Trump, but just since 16, 20, and 24, especially in California, those numbers really skyrocket over time.
But the point of the question is that if rural America isn't as white as it is thought in popular culture to be, if it is more diverse, do Republicans see rural America accurately? And how does the perception of what's really going on in rural America create blind spots for Republicans?
Well, if anything, they take it for granted, right? I mean, that's probably the safe thing. They take it for granted that Iowa's always going to vote Republican or whatever it is, or Ohio is now moved. But I think to Heidi's point is people are going to always vote their interest. People are much smarter than politicians really give them credit for. We talked about, well, if rural America is all going Republican, I say, well, go to Vermont. You tell me that they're all. I think Phil Scott is the last Republican in Vermont. I mean, tell Bernie Sanders.
Governor, I mean, he's hanging on in a good place.
Yeah, but Vermont isn't even Democrat. They're communists, for God's sakes. They really are. I mean, but really, it's probably one of the most liberal communist places you're going to find. And that's as rural as you're going to find as well. Or go to Maine, that leans Democrat. I'm just using the states around me. So I'm exaggerating. Well, I'm not exaggerating
attacking his neighbors.
No, I'm not attacking them. They're proud. They're very proud of it. But my point is this. Don't think that rural America is just conservative or anything like that, right? People vote in their interest. It's their culture. It's what they want. It's what they're getting. And we can argue whether it's good government or bad government or whatever it is, but they're voting for it. And they have every right to be successful or not successful with that system. But to your point, yes, Republicans, I think, do take it for granted somewhat. And again, especially at the national level, right? We talked a little bit before, if I can go a little far afield, I don't want to step on your next question, but how people consume information now is one of the biggest problems we have.
Then I am going to stop you because we have 2 minutes before the Q&A begins. We have 2 minutes before the Q&A begins, and I'm going to do moderators, what did you say? Well, you had a better senatorial
Point of
sounding-
personal
a point of
privilege.
personal privilege, moderator's point of personal privilege, to say this. North Dakota is a great example. It's great to be connected to the internet, but what if there isn't anything on it? If the only news that you can get, so we've talked a lot about the importance of broadband and connecting people and doing all that stuff, but if what you're plugging into doesn't talk about where you are, so something that I care a lot about and that I'm going to be sweating these guys to address is the news ecosystem. There, I did it too. Across rural America was wiped out in the first 2 decades of the 21st century. The internet came and destroyed a low profit margin business model for these newspapers, took out their classified ads, and people don't have the information that they need to engage in partnership with other Americans to engage in self-government because they just don't have reliable access. What have you seen about that, and what can we do about that?
Well, again, my brother has a radio talk show in Fargo, North Dakota. It's true.
I have to listen to this show.
All across, he talks to about 100,000 people every day, right? And he's more liberal than I am, but he's got the #1 show because he identifies, he talks about what's relevant in their life. And so is his bent bias? No, people call in and say outrageous things to him or make great points. I mean, so it's become the coffee table in a community that has lost the coffee clatch. What do I mean by that? I used to say, in North Dakota, you would walk into any cafe and there'd be 10 people sitting around a coffee table solving all the problems of the world if people would only listen to them. But there were Democrats there were Republicans there were Green Bay fans and Packers fans or Minnesota Vikings fans and no, in North Dakota. Anyway, my point would be that there was a diversity of opinion by gathering. And as we have retracted away from gathering places, as we have moved that dialogue onto the internet, we've failed to accommodate the need for diversity of opinion. Now, I would argue that if you want to know what's happening in the economy, you have access to all the Federal Reserve sites, whether it's, amazing wealth of information if you really want it. If you want to know about healthcare, Kaiser is a stunningly important kind of resource. There are independent resource places that you can send people, but it's many cases for people like me, it's, love it, consume it, but it's too dense. And we have not, and what the media used to do is take that reliable information and distill it into a manageable, digestible dialogue. And instead, we've abandoned kind of that opportunity. And so, the lack of community, we now get our community information on Facebook in North Dakota.
Yeah.
We know, and that can be right or it can be wrong. But without an active crowdsourcing for the truth on those sites, you will spread disinformation, which will lead to grievance, which will lead to further disintegration of civic life.
Okay. Now,
How is that?
That was fantastic. I want to go on your brother's show. It sounds
You
like
really?
I really will do it 100%.
Yes, Tony's been on Joel's show.
It sounds like a hoot, and I will 100% do it. I call into radio shows around I have standing bookings of rural radio
I just
shows.
say, don't forget radio. Radio is still really important in rural America. It's particularly important in Indian country.
Okay, we're going to go to your questions now, and to chum the water before we get to a great question from in the room. We're going to start with one of the questions that we received in advance on the aforementioned internet. And that is, how will this commission avoid the trap of urban-based institutions speaking about rural America rather than with rural America? I offer that accusatory question from the internet to you, Governor Sununu. What do you say?
Because they're not going to be speaking at all, right? They aren't. It's about making sure the people and the individuals are speaking. And that's why I think the board that you have here is a very diverse board. They understand the mission. We're not doing meetings in Washington, D.C. or New York City. We're going out all across the country. I think it's going to be almost a contest to find the smallest town possible and bring in the biggest crowd possible, and make sure that it's truly representative of all these different aspects of people that are on the ground. And it's just listening. It's listening. And then turning that into not just ideas, but truly actionable items. And that's the hardest part. What is actionable? Not pie in the sky. Boy, if we had $100 billion, we could do this. Well, that's a useless recommendation, right? Given the resources we have, given the timing, and given the immediacy of the need, what opens a door of opportunity? Because that guy that lives on, Main Street, USA, explained, one of the fundamental problems, and we've heard it time and again, not from the institutions. They're just, hey, thank you for the money, institutions. Thank you for the money. But at the end of the day, the money is really driving the opportunity for these folks to finally have a voice.
Okay. Who's got in the back of the room right there, all the way back in the blue shirt?
Hi, thank you so much. My name is Rachel Rush-Marlowe. I'm the Executive Director of Research Ed, one of the urban institutions, so based here, but I grew up in rural Vermont, so a communist, I suppose.
She's funny.
Sounds like you're reformed, though. You're reformed communist.
That's good.
Yeah. So I wanted to just say how excited I am about the future of this commission, and I think, we're in a time where things are obviously deeply divided, and we're in a very challenging federal climate. The senator spoke earlier about, at the end of the day, what people in rural and urban communities want is really the same, right? Like, we want the same things for our families. But I think the important thing is it's in the details, right, of how we get there. And obviously, I think Brookings and AEI working together represents a fairly bipartisan opportunity. But there's going to be differences of opinion. And so curious what the future of the commission looks like, in particular with, will there be more focus on federal policy, looking at things at the local or state level? How you're kind of conceptualizing that, especially given that, there's difference of opinion in terms of what should be federal responsibility versus left to the states.
If I can, avoid a groan for a political answer, we're looking for good policy, right? And that can be federal, it can be state, it could be local. So our quest is to find good policy solutions to the challenges. Those may be federal, they may be state, they may be community-based and supporting community institutions. So to me, I think it's really important that we not put a label on whose responsibility is, instead look at what is good policy and how and who should deliver it.
Governor?
No, that's absolutely right. And I think the idea is to have a set of these ideas, policies, and recommendations that every state could theoretically take and say, okay, this is clearly where we need to go. If the feds can help us with that, great. But if not, as a state, we're going to move forward with it. And it's a nonpartisan, bipartisan, whatever you want to do, approach. I mean, like I said, the closer you get to the local issues, the less the politics comes into play.
And the other thing is the role that philanthropy could play if you had evidence-based, this is a really good idea. Could you help us?
Mm-hmm. Excellent. All right. Right up here in the front.
Thank you very much. This is a great discussion. Fiona Hill from Brookings. I have actually one question that perhaps has been somewhat missed as an issue in this discussion, which is about age demographics. You've talked about all kinds of other demographic diversity and, obviously aging in rural America. At all different parts of that spectrum, from being a small child, all the way through to being elderly, is a very different experience. And I'm wondering about, how you might capture that as well, because, obviously rural America has few services for childcare, for example, and also very few services for elder care in the home and also in institutions, and extraordinarily difficult in different places. So have you thought about that in the terms of the Commission?
Go ahead. Senator, you go first.
I think that you're seeing with the pandemic, you're seeing some of that aging of rural America reverse, and you're not. It's not the deep decline that I used to talk about, which is how are we going to basically, who's going to turn out the lights, because everybody in rural America, is aging out of the system and we aren't retaining young people. And so to me, you've got to create a rural community that people want to live in. that people can say, that's where I want that. And you have to de-romanticize it. I mean, there's this, the agrarian myth. We are the product in this country of the agrarian myth. Do you think it was always really good to be a farmer, even in Thomas Jefferson? I mean, I suppose Thomas Jefferson liked being a farmer. I don't know, and so there's this agrarian myth, which builds on what Chris was already saying about the kind of, we're the real Americans. And so we have to be honest about what rural life is and what it means. But I would suggest to you that one of the challenges we have is the political diversification that's happening in this country. People are electing to move where people think the same way they do politically. And that has changed the dynamic and the opportunity for rural America. And we have to get back to a more welcoming, as Chris was talking about, diverse. We have to get back to a more accepting kind of community. I used to say in Matador, North Dakota, you accepted everyone because there was only 90 of us. Yeah. And the one guy who was a little odd, he was somebody's uncle. Right? And so you all took care of each other, so we've got to get back to those positive attributes, which is more diverse thinking, more diverse dialogue, and not this political separation. But I don't think we should sweep under the rug. When I ask my kids why they wouldn't move back to North Dakota, they'd say, if I could bring 20 of my friends with me. Yeah. Because they don't culturally identify with North Dakota.
And that's the problem, Governor, right? Which is births and burials, but not very many weddings, right? The people in the middle part of life leave and they go elsewhere. They go elsewhere and they don't start families there, and these towns dry out. And then when it's time to take care of grandma, right? When the people who are caught in the middle, there's not enough people to do it. What do you say about that? What do you think about that problem?
Well, I would say that as it pertains to this commission, I think the challenge isn't just making sure that we have a representation of young people. How do we actually get them to come to these sessions we're going to hold? Because they're going to be working, or they're a mom that's staying at home taking care of the kids. You'll get a lot of older folks come out, a lot of retirees. They have more time. They want to participate. They're more engaged in the issue. So what you have to be careful is that you don't just say, oh, well, the room is filled. The average age of this room is 65, so this must be the issue of the day. No, it's because how you set it up and how you have that discussion. So you have to use the technology, and you can't wait for everyone to come to you to participate in this. I think we as an organization is going to have to think really critically about how we go out and make sure that we're getting that real spectrum of not just age, diversity. We'll just be our own little DEI. No, I'm just kidding.
Oh my God.
But you
you
want that spectrum, not just who could show up on that day that you were in, Fargo or wherever we're going to go. Castleton, North Dakota. Yeah.
Yeah, what are you talking about? Didn't you see the movie? All right, we're going to go in the back on this side. We're going to get some representation from this side. Ma'am in the back, yes. Right there, hand up. Didn't you have your hand up? Yes, you see her.
Oh, I thought you said man. Excuse me. Hi, thank you so much for this panel. My name is Thea. I am the Executive Director of the Futures Institute, and Governor Sununu will let you know that my folks all live in New Hampshire in Campton, so exit 28 off of 93 North, so it is wonderful to see you here.
Tell them they don't have to pay income tax this year. Neither does anybody else, but you tell them to keep the money.
Will do. So what my question is, and this builds a little bit on Fiona's question of a moment ago, but when I was looking at those pillars, it did seem like there was one pillar that was missing, which was thinking about investments in kids. And that means investments in education from childcare on up. It also means thinking about things like third spaces and youth programs. And one thing I was really struck by is you had that graph from the book Injustice of Place. One of the things that really grabbed me about that book was an entire chapter called Nothing to Do Here But Drugs, and talking about how from so many of their interviews with folks in rural communities, the biggest driver they saw of the opioid epidemic was a lack of things for kids to go do. So I'm just curious, are there any of the pillars that y'all will be looking at that will be a chance to think about how you provide education and comprehensive, youth supports, or if not, are there other projects where folks are going to look at that more?
if I could, I'm just going to keep going back to the thing I harp on the most, and especially around kids, is transportation, right? So because they don't drive. So you have to have, whether it's the Boys and Girls Clubs organizations or Girls Inc. or whatever it is, all these often nonprofits that are providing those after-school programs, things to do, sports leagues, whatever it is. Those are all great, but it's where are they, and is there some type of, whether it's public or access to transportation or some way of getting them from here to there, because especially generationally, it's just going to keep getting, I think ultimately for the next 10 years or so, worse in terms of isolation, which is so dangerous for kids. That exacerbates the mental health issues, but it's too easy to isolate. There's nothing to do. But you know what? I was on my device, all afternoon, and I looked down at my phone at 5. I looked up at 7 p.m. and the time just blew right by. They don't even realize that they're not engaging.
And they're doom scrolling.
Yeah, it's really bad. So they think they're doing something, but to your point, they're not, because it's all about that social interaction. So it's really critical. But I think for kids and childcare as well, I mean, that's the big one. And too often, if I may, the last point is people ignore the kids issue because, like, well, there's public schools, right? Public schools takes care of that. No. Public schools are a fraction of the time. I mean, public schools are great. You have to fund them and keep them there, but they aren't just the backbone of what kids are engaging in like they were before.
I think, to be fair, I think the demographic and infrastructure is where we're talking about it. And one of the things that Chris and I were talking about earlier is the movement towards privatization of public education and what that means. And we expect that we will be having lots of dialogue about that issue, either driven from federal policies or from local policies.
Now for the man right there. The man.
Hi, Jonathan Horwitz, Housing Assistance Council. And Senator, I'm privileged to work with your great former staffer, Samantha Booth. I bring greetings. So as the name of our organization suggests, I'm going to ask about housing. Over half of rural renters are housing cost burdened, over a quarter of rural homeowners. I think we all know that housing is at the top of the list of what's on the public's mind. It's the biggest payment that most households pay. And unlike the addiction epidemic, Senator, it is something we have to supply side our way out of. And so I'm just curious about how the commission's going to think about that and kind of find a way around what might be characterized as democratic overregulation and persistent Republican underfunding.
Well, she gave it to you right there. What do you got?
I mean, I think that just to tell a story, we had 40 primary sector, meaning value-added jobs in rural North Dakota, and no housing for the workers. And so this has to be a collaboration with states. We have to look at what works, what doesn't work, and the one thing in rural America, because the last mile is always the most expensive mile, right? So bringing water and sewer systems, a lot of those systems are failing, and they're adding costs to green space, right, to expand, but also the crumbling basic infrastructure of rural communities and towns has to be addressed. Rural water systems that went in 30 years ago, I had a rural water system in eastern North Dakota that 30% of all the water they put in the pipe went into the ground with leaks. And so we have to identify the infrastructure needs. And I think the housing, when you look at housing costs, everybody wants to talk about, what it costs to build a house. And I'm like, I want to talk about curb and gutter. I want to talk about streetlights. I want to talk about city water and sewer and how special assessments basically will kill the affordability of that option. And so, I think if we could do all the things on workforce development, but if we don't deal with housing and education and healthcare, and we will have failed as a commission.
What do you do, Governor, in places? There's a lot of light blue, a lot of very light blue in New Hampshire and its rural areas, because there's a lot of very nice, wealthy enclaves where people don't want new housing built.
I was going to say the biggest barrier and the biggest issue of housing is the NIMBY thing, right? Everyone thinks that, especially if you're talking about affordable housing and workforce housing, that it should be in the city. We in New Hampshire just had a program where we said, look, do 4 units here, do 6 units here. We're not looking for massive apartment buildings. They think about it like it's 1975 Section 8, right? Crazy. And I would say the biggest problem is you have selectmen and town planners that are just old school thinkers, mostly in rural America, that just don't want it in their backyard. It's a NIMBY issue more than anything. There are a lot of land grabs on the federal level and all that sort of thing that have happened that have created a lot of regulations that, no, you can't develop here, can't develop there. I'm a big pro-development guy. If someone wants to build a building and put housing, God bless them. Let's fast track it. And a lot of those developers, it's not about the cash that you give them as much as they're saying, well, if it's going to take me 3 years to permit this project, I'm going somewhere else, right? There's the time value. So the time and the permitting barriers alone are huge. Again, I don't know if it's the right answer. In New Hampshire, we created a part of our courts just for housing appeals. That's it. So we could fast track them. So you couldn't get stuck in court for years, and a town couldn't hold you up, or someone couldn't hold you up in court for years and years and years. If you appealed something, it went right and got dealt with in about 30 days. So that was no longer an issue. And if the project had validity, it could actually move forward. So there's different ways to do it. But you got to hear from what's happening in New Mexico, what's happening in Iowa to figure out, best practice.
One of the challenges you have is how do you build resilient housing in the current environment? You say get rid of all regulation, but how resilient is the housing to weather patterns and everything else that's going on? So, I mean, but if there ever was an issue that needs to be locally driven, there's the negative, because frequently the town council is going to be older, more established, more resistant to change, and so that needs to balance. But I think these local issues of providing service are pretty critical.
I'm going to throw one more in there. What you're going to see more and more coming as manufacturers come back or they expand. These big manufacturers start and they're looking for jobs. They're going to say, I'm going to build a factory here, but they're going to actually build the apartments.
Yeah.
The manufacturers, the GEs of the world, or whoever who building the widget, they're going to become, and they're not going to just wait for someone to do it. They're going to build and run that housing for their employees, and provide that opportunity, because there's too much, to back up a $200 million factory with a $25 million apartment building is a no-brainer. Right.
In our next episode, we'll talk about the rebirth of company towns in
there you
America.
Go, yeah.
I did not know that we would get a cliffhanger at the end, and that was a great question, and thank you. It obviously got us cranked up. Now that is the time that we have. That is the time that we have. I'm going to give you an instruction, if these people can be instructed.
Everyone from Vermont is texting me right now.
Right, exactly. Bernie Sanders is blowing up your DMs. But you guys, I'm going to ask you to stay on stage. I'm going to ask our other speakers to come up because we will be photographed after this. But before you do that, I want to say this. Thank you so much to Brookings for hosting this event today. And thank you so much to our panelists for being here. And for continuing to show the kind of courage out of office that they demonstrated consistently in office. It takes a lot of guts to attack big, difficult problems. We have the right people for this. We have a great commission to do this, and I'm really excited about the work. So please stay tuned to what we're doing. That concludes our broadcast day.
Thank you, Chris.